Today we would like to present a full mouth rehabilitation case. We had a patient with missing all posterior dentition as shown in this panoramic radiograph and CBCT scan. Patient is missing all posterior dentition on the maxillary right side. A mid-crestal incision was made. And flap reflection exposed the underlying alveolar ridge. Drilling was performed according to the protocol recommended by Dentium, and the angulation was verified by placing parallel pin. The narrow bright tissue level implant was placed with a good primary stability. Bright implant enables safe, predictable and minimally invasive treatment. Its thin, deep thread design enhances long-term stability, while the dome-shaped body promotes superior primary stability and improved bone-to-implant contact in cancellous bone. Tooth number 13 was extracted, and the socket was irrigated thoroughly. Osteon xenocollagen was placed for alveolar ridge preservation. Osteon xenocollagen is a collagenated bovine bone graft designed for easy handling and effective bone regeneration with predictable results. Collagen Graft X1D was selected for soft tissue augmentation and to increase the width of keratinized tissue because of its enhanced potential for vascularization and epithelialization. Simple interrupted sutures were placed to hold the graft material in position. The mount screw was removed and the scannable comfort cap was placed. Additional suture was placed to hold the graft material in position. In the number 16 region, drilling was performed according to the protocol recommended by Dentium, and the angulation was verified. The sinus membrane was elevated. The bright tissue level implant was placed, and the Collagen Graft X1D was also selected for soft tissue augmentation and to increase the width of keratinized tissue. The mount screw was removed, and the scannable comfort cap was placed. And then sutures were placed to hold the graft material in position. Patient is also missing all posterior dentition on the maxillary left side. A mid-crestal incision was made, and flap reflection exposed the underlying alveolar ridge. The initial drilling point was marked with a surgical burr. Drilling was performed according to the protocol recommended by Dentium. And the narrow bright tissue level implant was placed. Bright implant enables safe, predictable, and minimally invasive treatment. Its thin, deep thread design enhances long-term stability, while the dome-shaped body promotes superior primary stability and improved bone-to-implant contact in cancellous bone. The Collagen Graft X1D was placed in the palatal and buccal sides to increase the width of keratinized tissue because of its enhanced potential for vascularization and epithelialization. Then sutures were placed to close the flap and hold the graft material in position. Postoperative CBCT and panoramic radiograph confirmed that all implants were well embedded in surrounding bone. In the posterior mandibular dentition, a bright tissue-level implant was placed, then Osteon Xeno and Collagen Graft X1D were used for contour augmentation. Intraoral scanning was performed, and the scan was then imported and the provisional crowns were designed using the AI occlusal plane. Because the patient had experienced a loss of vertical dimension due to long-term posterior tooth loss, provisional crowns were fabricated based on the denture-established vertical dimension and delivered. After 3 months of healing, CBCT and panoramic radiographs revealed stable implant osteointegration. 6 months later, additional implants were placed in the posterior region to complete the planned restoration. The second provisional restoration was designed with 2 mm increase in vertical dimension with virtual articulator, and then delivered to the patient. Intraoral scanning was performed for the final prosthesis. An anterior bite registration made with a putty index was used to verify occlusion on the CT scan. The scan was then imported and using the AI occlusal plane and midline feature, the prosthetic landmarks were identified and designed the final prosthesis. The rainbow shine T block was used to fabricate the final prosthesis. Here we can appreciate the final prosthesis.